Hey, 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 Dr. Joe, you are live coming from Atlanta. Welcome to my channel, To Your Wellness for Life, where we discuss wellness, all 9 components. You can see them on the screen behind me. Wellness is the state of being, and health is just one component. It is the disease-free state of body. All right. So today's topic is going to be, what if all the nurses quit? I know that is a very sensational kind of title, and it's designed to get your attention. I hope I got your attention. Obviously, not all the nurses are going to quit, but it's could get a little uncomfy for us. So I've been in healthcare for about 35 years. I've worked in the private sector. I've worked in the military. I was partially trained in the military, partially trained civilian. And over the course of the last 35 years, I've obviously worked with hundreds, maybe thousands of nurses. And they are really the backbone of the healthcare and disease management system. And we'll talk about that some more. But even before COVID and before the pandemic, this problem of having nursing shortage was already here. Now, the Health Resources and Services Administration has been making projections over the past years, 20 years or so, and they tend to be wrong most of the time because they just don't take things into considerations, many of the intricacies of what the needs are, what the population growth is, what the nursing profession is doing, and all the nurses that have gone into nurse practitioner. But I can tell you, one of the biggest problems has been before COVID is training nurses. So obviously, if you don't have enough nurses, you're not going to have enough nurses going on to advanced degrees, getting masters and PhDs to train other nurses. So that's the problem. You know, you can't train nurses if you don't have educators. So that's one big problem. The other problem is the aging population. And I'm a baby boomer. It's the post-World War II boom. Started in 1945 to 1964 or so. And it's an aging population. And with age comes disease. And with disease comes hospitalizations and need for healthcare and sick care. And nurses obviously are an integral part of that. And probably areas where nurses get stressed the most are going to be in the emergency room, obviously, and in oncology. You know, cancer rates are going through the roof, and you're dealing with lots of serious issues. So the aging population, my age, the aging baby boomer population, is really kind of fueling this. The other thing is that the nurses are also aging. And there's a projection that about a third of them are going to be retiring in the next 10 to 15 years. So just as I'm aging, the nurses are aging, and those are experienced nurses. So now we've got new ones entering the pipeline. Nurses are one of those professions that are pretty high burnout rate and high turnover. And the areas I already mentioned that are highest burnout rate are going to be in the emergency room, oncology, and med-surg kind of floors. And that leads to high turnover. In fact, about 14% of nurses on average at any time feel kind of unengaged. And the burnout rates are up to 41%. You know, they feel emotionally exhausted, and then they lack motivation, and they get very frustrated with their jobs, and they move on. You know, and a lot of them now with COVID and the pandemic, what's on their mind is, boy, now do they have an occupational hazard? And if they have children, they got families, they're thinking twice about whether they're going to step into that arena. So that's really been fueling this now and accelerating this potential for nurses thinking about other careers. And again, I mentioned they've got families, and you know, they may not want to enter into that arena. We do have a population that's still growing. We do accept a lot of immigrants. the population of America, actually the birth rate since the 70s has been on a decline. And the only reason our population is growing is because of immigration. But listen, we got over 300 million people now, and they get ill and they need nursing care, obviously. Violence in the healthcare arena, in the healthcare setting. Many, many years ago, when I was just a young physician, I made a decision to always be respectful to nurses and never, never, never give them any kind of constructive criticism in public. You know, you praise in public, and then you give constructive criticism in private. So that has served me well. But I certainly see other nurses and other healthcare providers and physicians not do that. Physical, so it's mostly verbal violence, verbal abuse that they are subjected to. And actually, patients do the same thing, especially in the emergency room and also on oncology kind of floors. Where I've seen some physical violence, wasn't necessarily a nurse, but I was a fellow at Emory back in the early 90s doing pelvic surgery. And I was doing a study in the emergency room. It was an SED kind of study. And there was a lady, we actually had at Grady or in Emory, we had separate different emergency rooms. We actually had an OBGYN emergency room, separate from medical ER, trauma, surgical ER, pediatric ER. And there was a lady who was convinced she was pregnant and she wasn't. And she came back. This was before we had all the security. She came back with a baseball bat and whacked a medical student over the head. And he ended up on the neuro ICU with a subdural hematoma. He ended up surviving and doing okay. But obviously, we don't leave doors unlocked like that anymore, because sometimes people do get violent. The other thing that has kind of driven some of the nurses away, especially older ones, is the advancing technology. My hospital just adopted a new electronic medical record system. And since I'm still in the thick of it, you know, I had to learn it. And there's a learning curve, and it leads to frustration, and the temptation is to just say, forget it. I'm too old for this. I'm just an old dog. I can't learn new tricks. But anyway, most of the nurses, I would say that they have embraced this new technology in EMR. And it certainly, especially in the ER, allows you to have access to different things and consultants and labs in one place that you can get online. So that's been good. All right. So those are the reasons why a lot of the nurses are thinking about job changes. And the pandemic has made this worse because it's an occupational hazard, and they're thinking twice about whether they want to enter that arena. Now, there's some discussion about, do we really have a shortage? Do we really have a surplus? In general, I would say we do have a shortage. And there are some states that are going to feel this pinch more than other states. There are California, Texas, New York, Florida, and Pennsylvania. And Georgia's kind of higher up on the list too. And so if you're ever in the emergency room and you're waiting to be seen, or you're waiting for your induction for labor and it gets delayed or gets pushed back, the reason many times is nursing shortage. We just don't have a nurse for you. And so that's how this really plays itself out. So solutions. Many times in my office, patients ask me, what career do you recommend for kids these days, you know? And I tell them nursing is a really good one. I'm not sure I would go so far as recommending medical school anymore. It's a lot of education. There are lots of other things that you can do to make a living. Lots of education. With nursing, it's a little bit less. And then there are wonderful things that you can do. I mean, with an RN degree, BSN degree, you can stay in nursing. And, you know, if you're burned down in one area, so I've seen a lot of labor and delivery nurses or emergency room nurses go into the clinic or office setting where the pace is a little bit slower, the acuity is a little bit less. And, you know, they kind of get resurrected, so to speak, and get less burned out. So you can kind of stay in that arena. Or you could start thinking about getting an advanced degree. And so that would be like nurse practitioner. And the area that I mention frequently is becoming a CRNA, a certified registered nurse anesthetist. And they make pretty good money. They're probably $125,000, $130,000. That's not bad for, a 4-year BSN degree and 2 years of your CRNA training. That's not a bad ROI, return on your investment. So that's what I recommend. And the other thing, if you're really a nurse and you're burnt out with all the clinical stuff but you don't want to kind of dump your expertise in the healthcare arena, you could get an advanced degree at either an MBA and go more the administrative route. There are CEOs of hospitals that are nurses, and they do a good job because they have a pretty good feel of what goes on in that building. The other thing is getting a master's in public health, and just thinking about another way that you could kind of get out of the acute setting is to work for an insurance company and be one of these nurses that they call on a helpline and kind of direct what patients should do. Should you go to the emergency room with that problem, or can you wait until your doctor opens his or her office on Monday? So those are things that nurses are dealing with. And obviously, for us as patients, and doctors become patients and nurses become patients, there's the rest of us. My advice to you, if this is going to be a real crunch now with the pandemic and nurses thinking about exiting healthcare, we have a nursing shortage, to try to get into the best health, into the best shape as possible. Get your weight down. As far as supporting your immune system, you want to not be obese. You want your BMI to be less than 30. You want to flood your body with plant matter, and you want to have moderate exercise, at least 4 or 5 times a week for about 30 minutes. And just brisk walking is plenty. You don't have to become a marathon runner or some super duper CrossFitter that's going to be competing in the CrossFit Games. What else? So what else could nurses do? And I actually have a list of about 9 non-nursing job options for nurses. And I know I've yacked on here for a while. So if you want that, so with a nursing degree, these 9 other options would really be an amazing addition to these 9 different jobs that are non-nursing jobs. Get out of that high acuity area where you've burned out, and embrace 9 new professions where your RN degree, your BSN degree, or even your LPN degree would be a distinct advantage. So if you want that, drop me a comment, send me a private message. I'll be happy to send that to you. And I hope you found this discussion helpful. What if all the nurses quit? Hopefully they won't all quit, but we got a lot of them retiring and a lot of them thinking about making career changes. So I hope you have a wonderful evening. Enjoy the rest of this Thanksgiving weekend. And if you're a nurse and you're thinking about making a change, remember, you need to make that change. And then whatever you do, you have to be consistent with it, and you can't quit. So if you're going to make a career change, add to your education, you need to be consistent with it and not quit. And on that note, we'll catch you tomorrow. Bye.